Welcome to Mind Your Being. Whether you're a returning listener or a new listener, I'm so grateful to have you here. Can you believe it's February already? I feel like this year is flying so fast. Now, I know we all get caught up in our crazy schedules at time, but I hope you're taking some regular time out just for yourself each week to check in, to care for your well-being, and to have some fun. Now, this episode is the longest episode to date. It runs for about an hour, 40 minutes, which is huge. But I want you to know I don't take your time for granted, but this is a really human, beautiful conversation. And I think there's bits in here for everyone. So don't feel like you have to listen to the conversation all at once. You can listen to it over a number of days, or you can look at the chapter list. You can skip back and forth between the chapters that you're interested in. And as always, please feel free to provide any comments or feedback, suggestions for future episodes, either on social media, Instagram or Facebook, or through our Mind Your Being contact page on the website. I'd love to hear from you. Thank you again for being here to take time to mind your being. In today's episode, I'm joined by clinical psychologist Mark Baxter, who is the director of the psychology spot here in my local community, Wollongong, New South Wales, Australia. Mark has spent over 2 decades helping people heal from trauma, PTSD, depression, and the lasting effects of adverse childhood experiences. This is a really wide-ranging conversation. It was so relaxed and free-flowing. At times I forgot we were recording a podcast. But together we explore how early life experiences shape the beliefs we carry about ourselves, beliefs about our worth, our safety, our lovability, and how those beliefs quietly influence our behaviours, our coping strategies, and our relationships. We talk about depression as more than a label. We unpack how trauma can become stuck in the nervous system. We talk about evidence-based treatments like EMDR, but I also asked Mark to come on to talk about the emerging space of psychedelic-assisted therapies, including MDMA-assisted therapy for PTSD and Psilocybin-assisted therapy for treatment-resistant depression. But at the heart of this conversation is something deeply human, the idea that healing isn't just about fixing yourself, it's about understanding yourself. It's about self-awareness, self-compassion, and ultimately self-acceptance. This is a beautiful conversation and I find it really hopeful, and I hope you will too. Please enjoy. So welcome to Mind Your Being, Mark. Thank you for being here today.
Thanks.
I wanted to let the listeners know that we've been connected through a mutual friend. Shout out to Ricky.
Yeah.
When he found out I was doing the podcast, he had mentioned you over the years. And I'm like, oh, could you reach out and see if he's maybe interested in coming on? And yeah, thank you for agreeing to come on.
Yeah. Rick's been a friend for forever. So
he's a great person.
Friend.
Yeah.
Yeah, the best.
Yeah. To start off with, could you please share a little bit about your background as a clinical psychologist and maybe what first motivated you to work in mental health?
Yeah, that's a big question. I was 17 when I had to decide what to do at uni, and I was going to do forestry and go to Canberra. Okay. And then I realised that when the time came, I didn't want to go to Canberra. All my friends were in Wollongong. My second pick was psychology, and I can't even remember why. And I just decided at the last minute to do that, mostly because I just wanted to stay around Wollongong and the lovely place we've got here. And so I did that, and it wasn't until I sort of left, went overseas, did some stuff, worked, and came back to Australia after a period of travel, got a job in the field, the practical application of kind of the work, and just went, oh, yeah, I love this. And Great. Then went back and did some postgraduate work and stuff like that. Realised I loved the actual being a psychologist, working with people, being with people, that kind of thing. So That's when I sort of got a passion for it. And that was back in the 90s. So that was like a long time ago now.
Yeah.
And then from there, I've sort of just, yeah, I just keep rediscovering what this field is, what the role is, how I can be helpful in it. And I keep changing my interest areas. And in 2017, after working in the government and non-government area for many years, I opened my own practice, which was like a really big thing I'd always wanted to do. Started doing private practice, started doing a lot more therapy, and just kind of evolved over the years. And now have an interest, in post-traumatic stress disorder, in trauma recovery, and recovery from adverse childhood experiences, and all the things that come with that, whether it's depression, anxiety, obsessions, compulsions, substance use, eating disorders, all the bits and pieces that sort of happen as a result of those early experiences. And so, yeah, that's kind of what I'm focused on now, and looking at emerging treatments as well, as we'll talk about today, right? The psychedelic-assisted therapy stuff, but also, there's some really great psychological therapies that are really helpful. So, yeah, we'll talk about all that.
Thank you. That's the thing. People study psychology. Some people go into research, and that's where those emerging therapies originate from. But then we also need clinicians like yourself putting the research into practical use to actually help people. That must be really rewarding, helping people and seeing people progress in their treatment and get results.
Yeah, absolutely. People ask a lot about what the evidence-based practices are. So that's one thing I think we're going to talk about today. But for me, it's the practice-based evidence. So like, what do we see in the room? How do we track that? What's the person's experience of that? What's meaningful for them? What does change look like for them? And we know that it's not a one-size-fits-all. So I think as we get into, what is depression, what is PTSD today, I'll talk more about kind of the scope of how large this is, and in some ways how ineffective those labels are in and of themselves, that we've got to go much deeper to find out kind of like what might be workable for someone.
Because it's unique for everyone. I've talked about on here before, a label, say I have OCD, it's just a diagnostic label. My experience of living with OCD is going to be very different to someone else's experience, and the same with depression. And there's varying degrees to which one suffers with something. So, yeah, you would see the gambit of all of it.
Yeah, which is part of the sort of the enjoyment of it, if that's an okay term to use. Like, I love really finding out about people.
Yeah.
And not just like what's wrong with them, so to speak, or what they're struggling with, but like what's of meaning to them, what's of value to them, what their ethics are, how they think about the world, what their sense of kind of like life and death is, and relationships. Like, people come with that stuff. They come with like the issues that they're facing, but it pretty soon opens up into such an enormous arena.
What's underneath it?
Yeah, but also like then the early stuff, like what happened, what's your story, what's the impact of these adverse experiences that you went through, how did you survive that, and how did you cope with that, and how are those coping skills kind of past their use by date in a way. So often when people come in, it's their adaptive coping skills that they have to form through childhood, through high school, that have now become kind of part of the barrier to a bigger life.
Do some people come in with an awareness of that the coping mechanisms they developed are no longer serving them, or do they just come in their pain, or does it differ from person to person?
Yeah, just a huge variety there. So, I mean, one of the things we're doing when I first meet someone is just getting a sense of their insight, their reflective capacity, their metacognition, like their ability to notice and know what they're thinking as they're thinking it, their introspection, their ability to notice and know what they're feeling as they're feeling it. And people come with a wide sort of variety of kind of skills and experience in that area. It might be depending on their age or their temperament or their psychological know-how. A lot of people these days are very savvy in mental health, so they've read a lot, they've seen a lot. One of the upsides of social media is actually increased awareness, increased information, access to knowledge. And so people come in sometimes pretty kind of like, already have delved into some of this stuff. And that can be really helpful. Sometimes it's unhelpful. We've got to kind of like unwind some of that stuff and sort of clarify it. But yeah, people are pretty good at knowing more about what they want these days. So that's helpful. But we also, definitely get people who for different reasons, have a very low level of insight or very low level of skills or ability to kind of know their inner world or track how their inner world correlates to their behaviour and their outer world and their relationships. So yeah, a big variety.
I really wish it was something that we got some level of education about early, because you don't know what you don't know. And if you're not brought up in a family where your inner world or your feelings are openly talked about, like there are people, I mean, all of us to varying degrees, that don't know how to name certain emotions or feelings. And I think it's just really hard for people sometimes when you don't even have the basic understanding, but we're not taught that as a rule.
Wouldn't that be so amazing?
So
like emotional literacy at the very core, you know, even in kindy and stuff like that would be
for sure
would be such a preventative tool. Like, I mean, one of the main contributors to all the different kind of mental health struggles that maybe we'll talk some more about it today is this kind of like capacity of being able to notice what you're feeling and to allow those feelings to show up, to manifest and to complete. And so that's a huge part of the work we do. There's many different contributors to the different kind of mental health struggles that people have, but that's at the core something that we're always kind of working on. People have developed, you know, coping strategies to not feel their feelings, to push them down in ways that they needed to do at the time, and developing the kind of confidence and bravery really to feel these and feel them all the way through and feel them fully is a really important skill set. And I mean, if people could do that in primary school and high school and families were more orientated to that, like we would have such an easier run as adults, I think.
For individuals, but for society as well, and for even if you look at it economically, for the health system, we don't tend to have that preventative lens all the time. But yes, that is something I did want to bring up. Was one of the things that breaks my heart the most. You talked about people not being able to feel the feelings. So I'm someone who, if I'm feeling something, I just have to express it in a way, even if it's uncomfortable, like I have this internal, I need to express it. But I have grown up with family members who, for whatever reason, they're different, don't feel comfortable. And so, I did want to talk about, it breaks my heart that people feel like they need to suppress things. And then I think when you suppress something, it's still there. And I think underneath the surface, I think it intensifies. And then that can lead to different things like mental health conditions, but it can lead to, you know, emotional dysregulation or people trying to numb the pain like that they're feeling. So I guess my question for you is that what you see? People, if they don't have those skills or that awareness to be with the feelings, process the feelings, what does that lead to? What other behaviours can that lead to? And how can that lead to mental health conditions?
Yeah, I mean, it's a huge area that we work with. And depending on people's kind of early experiences, especially their early childhood experiences, they have a huge range of different relationships to the way that emotions show up in them. For some people, it's a matter of, you know, unexpressed emotions, and for different reasons, they've had to dissociate, block, numb, or move away from difficult feelings. And, you know, later on that can show up in forms like substance abuse or eating disorders or depression. And for some people, we're really trying to help them get in touch with, feel into, and express what's going on for them. And for others, they've kind of got this kind of overexpression in a way. It's almost like whatever shows up in them spills right out into the world. And for people like that, we're kind of helping them with kind of emotion regulation and distress tolerance, and helping them understand what's coming up, not be so confused about the mix of things that are coming up, give name to that internally, and then be able to kind of, use different skills to kind of be with that in a way where their behaviour is not automatically affected, and therefore their relationships aren't, ruptured in that way. So we're kind of working with this kind of spectrum, I guess, of under-regulation, over-regulation, under-expression, kind of over-expression.
Before we get on to talking about depression and PTSD, you alluded to before that in your practice you like to help people recovering from traumatic events or adverse life experiences, including events in childhood, and that these experiences can affect our mental health, our nervous system, and our physical health. It affects us holistically. So my question was, when someone has lived through this adversity or trauma, especially in childhood, how can that affect the way they understand themselves and their place in the world? And how might those painful early beliefs influence how they move through life?
Yeah, it's a huge aspect of the work we do, how we're programmed when we're young, so what happens to us and the impact of that and the resources that we have around that time, including the support from others, all play a part in how our belief systems form about who we are, how we trust or distrust, other humans in the world, and also our feelings about the world in general. Is it a safe place? Is it an unsafe place? So there's these belief systems that form from those early experiences, and those belief systems get kind of encoded in a way where you're not necessarily aware that they're kind of running you. So when you perceive the world, you're kind of looking through these lenses that you're sometimes not aware that you're looking through. So sometimes they might be called schemas or lenses. And not only do they form belief systems like that, but they also affect the way that our body and our nervous system and our brain kind of interacts with people and the world and challenges that come up. So if I just go back a step, there was a large study called the Adverse Childhood Experiences Study, and they tracked and followed about 17,000 people over many, many years. It's a fascinating study because they're looking at the correlation of adverse childhood experiences and later struggles with mental health and physical health. So adverse childhood experiences are things like, did one or more parents have a mental health condition? Was there someone that was coming in and out of jail? Was there any drug or alcohol use in the family? Was there neglect, emotional neglect? Was there abuse, sexual assault, that kind of thing? So, things that are difficult for children to go through. The fascinating thing about this long-term study is we'd expect to see, mental health conditions being kind of directly kind of correlated with that which we saw, but it was the physical health conditions that surprised people. Heart conditions, cancer, drug and alcohol use, economic situation. So it was this range of kind of physical health issues and chronic health issues as well as the mental health issues. And so what we're kind of finding is that what happens in childhood, and more importantly, the support or lack of support around that, sets us up for not only the way that we relate to other people and ourselves, but also the way our body gets inflamed by chronic stress and how that inflammation starts to go on to create these chronic health conditions in a number of areas that we thought are just, totally physically related. So, from a psychological perspective, we kind of have this opportunity, I guess, to kind of go back using different psychological methods and not only understanding what happened, but using different tools and techniques to kind of transform our relationship and kind of unencode or change the patterns emotionally at a nervous system level and the belief system level as well. So that's a lot of what we're doing, especially for people with chronic mental health conditions that they've had for quite a long time and haven't responded to many treatments. We often need to sort of go back to some earlier experiences and make sense of those, but also process them in a way where they're current here and now life changes.
Did you read that book, The Body Keeps the Score?
Mm-hmm.
Yeah, I just find that so fascinating. And the effects on your nervous system, I find for myself, like I do a lot of practices. I've had therapy and I feel pretty good most of the time, but I feel like compared to some other people, I really have to watch stress. Like I feel like, based on childhood experiences and how you grow up and stuff, I don't know, sometimes I just feel like stress might be still in my body and I'm like, what do I got to be stressed about? But I feel like I have a lower tolerance than some people, if that makes sense.
Yeah.
So yeah, it's just interesting how it's holistic, like it's your body, it's your psyche.
Yeah, a nervous system stress isn't always about what's happening here and now. Often we're looking around like what's happening in work and life and relationships, and sometimes that makes a lot of sense. But as often, we're being unconsciously activated and triggered by certain conditions in the environment and in what's happening that's bringing up old stuff. And that can be really underneath our conscious awareness. And so, part of what we're doing in therapy too is trying to open our consciousness and our awareness to start to see this old stuff showing up. And once we see it, we can describe it, we can feel into it, we can kind of work with it a little bit. Yeah.
I mean, I've always been fascinated with psychology, but one of the reasons I'm so pro-therapy and encourage people if they're struggling to get support is because if you had problems with a physical issue, you go and get some help about it. So it's getting the right support and the right help if you're struggling to be able to unpack things and get that insight. But as you said, not just the insight, to learn some tools and strategies to move through and process things and just that there's help available to help people to have more ease within.
Yeah, there's lots of stuff. And I'm not sort of wedded to therapy so much. I mean, I think that's one aspect of how people can get help. Yeah. And there's a lot of different therapists and psychologists, and there's a lot of different therapy types. Like, I encourage people to, try and see what works for them and to shift and move if it's not working.
Yep.
But also life is therapy. Like, there's so many different ways to engage in life. You saw my black eye today. We were laughing about, because I practice Brazilian Jiu-Jitsu as one of my self-help things.
Yeah.
And plus I just love the sport. For me, that gives me a lot of benefit and helps me in my nervous system regulation.
Right.
And I kind of need intensity of that level for my nervous system to be able to then reset and relax and enjoy life. So I need the intensity first to get the relaxation second.
Right.
So there's something I've learned about myself and the way I'm built.
Yeah.
Everyone's different. So I encourage people to find what works for them. Time in nature is really important.
Yeah.
Music's really important. We could go on with a lot of different things, but life as therapy, I think, is something I also respect. So I'm kind of like sometimes therapy's not the right medicine for the job. And sometimes getting the help of a therapist, that you do a bunch of work around some stuff that's coming up. You find your feet again in some way and then get back into it. And then maybe you come back and do some therapy later or something like that. So I think seeing it in batches, that's the way I encourage my clients to think about it.
I think I've probably done 2, 3, maybe lots of therapy. One of them wasn't with a clinical psychologist, but I got a lot of benefit out of that as well, but also with a psychologist. Just different times, you need different support, I think. And
I see an osteo who has a particular approach, very nervous system orientated approach. And for me, it's non-verbal. One of my batches of therapy has been with her. And so that was, really, really helpful for me. But it was outside the realm of kind of talk therapy. So
lots of different things. I might get her name from you after this as well. Okay, so as we talked about, I wanted to ask you to talk about depression, PTSD, and then some emerging therapies that are showing promise for when these conditions are resistant to standard treatments. I'm sure everyone's heard of depression. It's quite common, but I think it can be quite misunderstood as well. So when you're talking with your clients or their families, how do you explain depression to people?
Yeah, I'm glad you're asking about this, and I took some time to think about it because it's one of those kind of catch-all phrases that means so much and kind of means so little as well. So people will often come with like a referral around, depression, anxiety, those kinds of things. And so it's something that many people have had experiences of or have loved ones or family members, colleagues. So I think it's important for us to kind of, look at this in a little bit more scrutiny, I guess, and put the lens on it. So I'm glad you asked. In some ways, I think about depression more as a kind of a syndrome than a diagnosis. A diagnosis is a specific thing that we know about, we know the history of and how it's caused and why. Whereas, at the moment, a major depressive disorder is a diagnosis, kind of like a grab bag of a bunch of different kind of symptoms. So we got things like fatigue, lack of drive, sleep issues, numbness, cognitive impairment, low mood, sadness doesn't go away, excessive guilt, sometimes anxiety, things like that. And that in itself is kind of like, when we look at what's happening underneath that, there could be a whole range of different kind of causative factors for that. So one issue with the diagnosis is it doesn't sort of give us that much information. It just sort of names a bunch of things which the person already knows about. So I just spent like, a minute writing down things just to give your audience just a flavour of kind of like as someone comes into therapy, or they might see their GP or someone, like, what are we initially looking at? What are we doing here? And part of what we're doing is understanding the person's story, but also keeping our eyes open for, the things that might be contributing to their situation. Things like their sleep patterns, substance use, as I said, adverse childhood experiences and trauma, chronic inflammation, bipolar history, low thyroid, low testosterone, elevated cortisol, chronic health conditions, loneliness, isolation, estrangement, obesity, learning disorders, hormone changes, body dysmorphia, dissociative issues, medication side effects, head injuries, surgery, complicated grief, prolonged anxiety. We could go on and on and on. And so one of the problems with the diagnosis of depression is it doesn't really give us much information into what's going on there. So it's really important that we start to get a little bit more curious about some of the things that are kind of contributing to what's happening. And likely there's a mixture of kind of biological, interpersonal, social, psychological kind of stuff there. Often there's an interplay between these sorts of bits and pieces and also the adverse childhood experiences I was talking about, patterns and ways of coping, a person's belief systems about their worthiness, about being good enough. So when I see depression, I see this huge kind of like the tip of the iceberg, like what's underneath that.
Right.
And part of the journey with someone is not just launching straight into trying to kind of fix the problem, so to speak, but it's like really understanding what's happening and understanding the person's journey and relationship with what's happening in their life and living with this. Sometimes if someone's been depressed for a long period of time, because it's such a distressing and helpless and hopeless, meaningless kind of experience, that the fact of living with it for so long and the impact on their life can be a giant thing in itself. So there's lots to understand and lots to kind of unpack and get to know.
Yeah. As you say that, there's so much underneath it. So the importance of really getting that history and, like you said, that personal understanding. It's so heartbreaking, the hopelessness or the despair.
Yeah.
I think maybe with some other mental health conditions, people might be given some more hope, or they might even exist with the condition and have hope at the same time. But to not have hope or to feel despair, like nothing's going to fix this, would be awful.
It's very tragic to see and to work with someone. It's really heartbreaking. So you've got this, sometimes a deep despair and hopelessness, but then you've got this kind of like guilt and shame as well, that there's something wrong with me, I'm not doing enough, I've failed these treatments. I know that came up the other podcast with
on OCD.
On OCD with David Cooper, and he was saying something like, I haven't failed the treatments have failed you. I thought that was an interesting reframe. Like, people have tried a lot. They might have tried transcranial magnetic stimulation, they've tried a bunch of medications, they've tried electroconvulsive therapy. They've tried all these different therapies and meds and whatever, and they're still in the same state. They feel very stuck. So that's a very difficult space for people to be in. And some of the work there is really holding like a candle of hope for people as they re-find it themselves. That can be really difficult, especially if people come to you after years of being stuck.
And trying to give someone hope, but also knowing you only see them for the allocated appointment time. And yes, you may give them some strategies to try and stuff, but for them to know that it's not going to be an overnight success, and if they have tried things before, that must be difficult at times for you to try and really give them hope.
It is. It's a really, really hard part of the job. And also a lot of what's contributing to their stuckness is what's happening interpersonally and in their networks or their lack of networks. There's long-term isolation, there's loneliness, there's disconnection. Some people don't have people in their life. Some people have people in their life, but they're not actually emotionally connected to them. Some people have barriers to getting meaningful work, and so, they don't have something that they're doing that brings meaning and value to their sense of self. So there's a lot that we don't really have access to, and there's this idea that, there's tools and techniques that are going to help someone, but often that's not actually what we're doing, can be part of it, obviously. And the thing about treatments and therapy is, what we forget to keep talking about is that, most of the good therapies get pretty much the same results. The therapeutic relationship and the therapeutic alliance is the thing that's more predictive of outcomes. And what we're trying to do is establish this kind of reciprocal, trust-based relationship that allows the person to experiment, to be curious, to be vulnerable in a way that they haven't been able to before, to find out about themselves, to take risks, to test themselves interpersonally. And so that's a long journey. And that doesn't take 6 sessions like under a mental health treatment plan. It sort of takes a couple of years. So we do need to orientate people to, maybe the sense that this is going to take some time. But I do know, because I've been doing this long enough, that if people do stick to it and they keep showing up, things do and will get better. I do have faith in that because I've seen it so many times. So do try to encourage people to kind of stay and stick with it.
And I'm guessing there's like a compounding effect as well. Like, they might not see initial progress at the start when they're unpacking stuff and being vulnerable, but over time the effect would compound. And the importance of the therapeutic relationship between the treatment provider and the client is one of, if not the most important predictor of whether there will be benefits from treatment, I guess.
No, that's well said. I mean, that's a better predictor than the type of treatment. So we're often looking for, what's the type of treatment that best fits this, as if there's a manualized treatment that's going to be the right fit for a person. And, there are lots of treatments that are really good, but the main predictor is, are you getting along with the provider, the therapist, in a way that you're able to feel supported, take risks, feel validated, but also be, pushed into growth as well. So that's a combination between support and challenge.
That's why I always say to people when I encourage them to go to therapy, I'm like, try it. If you're not engaged or you don't particularly feel comfortable or particularly like the therapist, it's okay. Try someone else. Like, you really need to be searching for that right fit.
Absolutely.
Where you feel completely comfortable and at ease to get the best results. I mean, it's like anything. Everyone's not going to be for everyone. So if you're not feeling a gel or a fit with a particular therapist, then
if you're getting bad haircuts, like, get a different hairdresser.
Exactly. It's a great analogy.
Yeah. And there's also, like, I think you're sort of pointing to this too, like, also stick with it. Like, sometimes you'll just know, there'll be an intuition and you're like, this is not the right fit. Follow the intuition. But sometimes you're like, this is really uncomfortable. I'm not sure about this. And it's like, that's
different.
Yeah. It's like, okay, what's happening here? Because uncomfortability is really where we want. We want support. It's going to be a given, I think. But we want that uncomfortability too. And if we're getting into adverse childhood experiences and trauma and historical stuff, it's going to be really painful, actually, and disturbing and destabilizing. So that's kind of what people are signing up for. But the therapeutic space and the person you're with, there should be so much trust and support and validation and mutual regard and, therapeutic kind of like spaciousness there, that you feel like you can do that really difficult work. Yeah. And that takes time to develop,
Yeah. Don't give up after the first session.
Yeah. It's tricky finding a psychologist or any provider that matches you and what you need and has the skills, but also has the kind of the vibe, I guess, that you're looking for. It takes some time. So I would say to people, don't be afraid to kind of like take a bit of an experimental attitude and take some time to find someone that suits them.
So what are the current evidence-based treatment options for the label of depression? As you mentioned, there's a lot of things underlying that. What are the standard treatments on offer at the moment for people?
So this is really tricky as well. It's tricky for psychologists in this because there's politics underneath what gets put forward into clinical trials for evidence. And by the politics, I just mean there's certain practices that are embedded in universities, and universities have a lead role in doing clinical trials. So some of the therapies that people practice that are really effective and quite powerful aren't sort of embedded in universities, so they don't have clinical trials results, and some are embedded, so they do.
Yeah.
So some of the stuff that has a lot of good evidence is cognitive behavioural therapy, as you've talked about in your podcast before, things like acceptance and commitment therapy, things like schema therapy, interpersonal therapy, narrative therapy, things that are really powerful and fantastic treatments too that aren't really embedded in those academic contexts, the internal family systems therapy, which is something that I practice, which is really great at going back and working with those early experiences and how they're affecting us in our current life and transforming that. Imagery rescripting, which I noticed that your last guest kind of reported back on. There's things like sensory motor psychotherapy, which really gets to the core of the nervous system and the body and the posture and how that shows up in some of these patterns. Existential psychotherapy. Another one that I practice that has a lot of evidence in the trauma field and emerging evidence now in the depression field is EMDR, or eye movement desensitization and reprocessing therapy, which again is very good at targeting, belief systems, patterns, early events and how they show up in everyday experience. So there's a bunch of therapies I've probably left off there, but there's lots and lots of really, interesting stuff. Many of them really coalesce around, similar kind of mechanisms of therapeutic treatment. I guess there's a lot of similarities between them. There's also some key differences as well. So yeah, there's quite a lot.
I am interested in that internal family systems, but yeah, I realise we only have a limited amount of time, but that's fascinating.
We can do a whole podcast on internal family systems.
If you're open to it, I'd love it.
That's a large world. I mean, what's exciting about that, just quickly, is that it's one of the therapies that acknowledges and brings in the kind of the spiritual aspect. So it's kind of psychospiritual therapy type. So for some reason we've left out in our westernized kind of, psychotherapies, we've left out the meaning, the existential, the spiritual. And by spiritual, I don't mean a deity or a god. Yeah. I just mean what is bigger and larger, what's the large container that we're kind of sitting in, and what does that mean to you, and how do you relate to something that's beyond just, your everyday experience. Yeah. So many people have a sense of that in their own way, and this is a therapy that actually brings that into the therapy room, in addition to all the other bits and pieces that you would regularly do in therapy. So there's different things about IFS that make it unique, but that's one of them that I think is really interesting. Yeah. And as we talk about kind of psychedelic-assisted therapy, that's another modality that brings in the spiritual and the existential and these larger transpersonal areas, and which is a crucial part. Like if someone's depressed, what am I here for? Does life have meaning? Why am I waking up in the morning? Why should I be alive? Like these are big questions.
The answers matter. The answers that they're getting matter.
Yeah. So we need to go to that stuff. It's not just like, what's your thought coming out? Can we change that thought and think about things in a different way? That can be helpful to an extent, but there's these larger questions. Yeah.
That's why I'm interested in the psychedelic therapy, the IFS, because as you said, that spiritual, that larger component, I'm fascinated by, because we're not just our mental health. We're a holistic being. And I think it's important to understand how everything interacts. With the IFS, it can really help someone understand different coping mechanisms and why they develop those. But I think it can really, I haven't done it, but my understanding is it can really make it apparent to them, these are not working for you anymore, and do you understand why? And then ways to move forward. And
Yeah, I mean, true growth is not just about, reducing symptoms and increasing functioning. Sometimes that's what people need and want, and that's really helpful. But often people are coming for much more than that. Like, what is my life? What am I doing? I've done half of it and this is how I've coped so far, but is this it? And what do I want the rest of my life to be about? And when I start reflecting now on ancestors and my parents, and my parents are getting close to death, and what does that mean about my relationships? And like, they're the questions that we come to, really. It's not
what
just
makes
about
a good life, or a fulfilled life, or a content life.
Exactly, yeah.
I talked about in one of the episodes recently about how midlife especially can be that time, and I know it was for me as I sort of got towards 40, where you start to reflect, if you haven't already reflected on those big questions that you were talking about, it starts to come up naturally, I think.
Yeah.
Yeah, start to wonder, how do I want to live the rest of my life? Because I think as you get older, you sort of realise, well, you don't know how long you're going to live.
Yeah.
No one knows for sure.
Yeah. We spent a lot of the first half of life building things, building our coping, building our family, building our finances, building a career. There comes to a point where it's like, what is all this stuff?
Am I satisfied with all this stuff?
And actually, the second half is like about pulling it back and tearing it down a little bit. And like, what's not really useful here, or what's just me surviving actually, rather than actually thriving. And they're big questions.
100%. I always say that if we have a choice, if there are things we can do to thrive in life instead of just survive, then what are they? They're going to be different for different people.
Yeah.
But the exploration of those is important.
And it might be something around, the bits and pieces of life, but for many people, it's like getting in touch with their anger again, saying no, setting boundaries, and
It's
knowing what a
massive.
boundary is, and like setting it with confidence, and dealing with the guilt that comes with that, and working with the secondary guilt.
Yeah, I
And then
hear
understanding
it a lot.
underneath what's going on, like what's driving this kind of like, why haven't I been able to express this? It makes a lot of sense when I look back, and we can kind of work, So sometimes it's around that kind of stuff. It's like, how can I be more me?
Yeah,
How can
because
I unmask,
I think that can lead to physical symptoms as well.
Yes.
When people aren't comfortable or don't know how, or haven't had experience in setting boundaries, and maybe they're a people pleaser and then they repress their own wants and needs. And I hear it a lot, especially like I'm 51 at the moment. My friends, a lot of people, really struggle to set boundaries. And you're like, if we're still struggling in our 50s, what about I don't want that for my kids as they get older. So again, just to raise awareness and for people to think about these things, I think it's good.
Yeah. And healthy anger is part of setting boundaries.
Yeah.
We think about anger as in like some of its more corrosive forms, but there's an energy there that people want to get in touch with. People pleasing and self-sacrificing, they're huge things that come up in the therapy room a lot.
Okay, yeah. Because it comes at a cost for the individual, a big cost.
Yeah. Chronic health conditions, inflammation, dissatisfaction, just disconnection, just people not feeling themselves anymore. They realise they've spread themselves so thin for everybody else. They're not really sure what they're about. And sometimes something happens. There's a breakup or a transition or a life thing or an injury to ill health or like a loss of a job, and all of a sudden people come into contact with something that they've not been conscious of, or they've been avoiding, or they've known for some time but it hasn't been right to come to. And so that's the stuff I really like to do when someone's like, right, I'm here to do this thing because now's the time.
Yeah. Like we said before, it would be great if we learnt more of this stuff or had more of an understanding earlier, but often it is a crisis. But, it's better for people to get treatment in midlife than to not and go through their whole life feeling discontent.
Yeah, and maybe resentful and maybe bitter and, there's lots of different things people carry.
Is it worth touching on pharmaceuticals for depression?
Yeah, I mean, I'd like to say a little bit about it. I mean, I'm pro what works. What works for people is just a huge variety of different things. And so one of the downsides, though, is that with antidepressant medications, and there's a great podcast called Back from the Abyss with Dr. Craig Heacock. He's a psychiatrist from America, but he talks about what we normally call the antidepressants, which are the SSRI antidepressants. They're particularly good for depression that's caused by negative ruminative thinking, sort of neurotic tendencies, but they're not actually good for other types of depressions. So when people think about getting medication as a treatment option, often they've tried a medication or two and kind of not had a result from that. But what he's encouraging people to do is to see a practitioner that has a lot more kind of nuance and understanding of the wide variety of depression, and maybe there's medication types which are a much better fit So I would just encourage people, if they haven't had success in that area and they feel like medication is something for them, to look more broadly. Like we were talking about therapy, don't give up because you've, antidepressants in inverted commas haven't worked. There's many different classes of drugs that can be helpful. And just one other thing about it, on the downside, there are upsides. I've seen it help so many people. But on the downside, people can get a sense of emotional blunting. They can feel a lot less. So it can take away some of the more difficult aspects of being depressed or anxious, but it can also take away like joy and enthusiasm and some of those things as well. So I just say to people to keep an eye on that sort of stuff. And sometimes depression medication has side effects that you just need to trust yourself and talk to your medical practitioner about.
And will the practitioner sort of generally work with you to maybe try and find a balance?
It depends, because some of the emotional blunting effects look like more depression.
Right.
So I'm not feeling joy in anything. It's like, oh, well, you're depressed, of course. But we just have to be a little bit more nuanced and savvy about, the medication, how long it's been prescribed for, the impact of it, the side effects. And sometimes, like I said, to see a different, psychologist or practitioner, sometimes it's worthwhile getting a second opinion on that, or seeing a psychiatrist, even if you don't think, that's something that you would traditionally think about. Sometimes it's worthwhile just looking at that as well.
Because I'm not sure if people know, like the psychiatrist is actually a trained medical practitioner and then they do the psychiatry on top.
That's right.
So they would generally... Can you explain, please, the difference with prescribing medication?
Yeah, the GP's at the focal point. So there's such an important piece of this kind of like the mental health puzzle about how people seek treatment, get treatment. But from a GP, they've got to know so much about everything, and they do. But when it comes to specialised mental health care, that's why they refer out. So they refer to the psychologist to do the therapy. So psychologists can't prescribe. We've seen, dozens, hundreds, thousands of people on different medications. So we've got a pretty good sense of like how it shows up in people, the lived experience from hearing people's narratives and stories. So we can kind of help a little bit in that way, but we don't have expertise in that area. We can't really make good judgments or make prescribing decisions. So that's where a psychiatrist comes in handy. And psychiatrists do lots of different things, but one of the things they do is medication management. And because they're focused specifically on mental health, that's where they got their nuance and their expertise. And that's where their specialty can be particularly helpful. So if you're considering medications, or you've been on them for quite a while, or you're on some and it hasn't worked, for sometimes people want to see someone with that expertise to really start again or look afresh. The other thing people sometimes need to do is taper off medications, and that can be particularly tricky. So there are some programs in Australia now that are helping with people taper off. There's some guidelines that can help people do that, and the way that's done can make a big difference. So there's lots of nuance there that I would encourage people to not give up there as well, to really go back and try to see about their medication use and whether there's something that can be tweaked or changed.
Thank you for that clarification. Yeah. And also, I guess there's always new classes of medications being developed and
unfortunately not.
Oh, no.
That's where we're going to talk about psychedelics, right? But it would be great if like every year there's another class of...
Oh, see, here I am thinking, the pharmacists are developing all these new...
Now we've kind of run out of ideas a little bit there. But people are using the current medications in more, I guess, creative ways. So for instance, the psychiatrist I was working with recently, someone had a really low, sort of very melancholic depression, someone who couldn't get out of bed, someone who cognitively foggy, someone who had no drive. And so they were using like a stimulant medication, the sort they use for ADHD, to help that person with their drive and motivation, just to get them up and help them start to engage in the therapy they were doing. And that was, helpful in that situation. Yeah. So again, often it's the combination of therapy and some sort of medication. I would say to people, if you are using medication or you're interested in that for any mental health condition, consider the augment with therapy. Yeah. Because that's where the power is, I think. Yeah.
And like we were talking about, that compounding of the results together.
Exactly.
Get the best.
Use the window of opportunity that the medication may give you.
Yeah.
Make use of that to make some big changes while you can. So I'd encourage people to think of in those terms.
Thank you. That's great.
And just to acknowledge too that, psychology sessions are outside the reach of some people, that They're
Yeah.
expensive, not accessible for everybody. And so it's sometimes all well and good for me to say, go and do that. But
No.
people might have the
Yeah.
finances or the time or
So
in regional
hard.
areas, rural areas, the access. And so that's really difficult.
Is telehealth psychology becoming more available?
It's huge, yeah. After COVID, everybody got really comfortable with telehealth. And so now probably about 30% of my work is on telehealth.
Okay.
So it allows people from all around Australia and actually the world to access me.
That's fantastic.
Yeah, and it works well. People, if they can decide and choose, they'll always come in because they enjoy that. But just for convenience or travel or health reasons, telehealth works well.
Yeah, that's great. Before we get to looking at the psychedelic treatment options, I just wanted to quickly touch on another condition that can be quite misunderstood as well, but quite debilitating for people. PTSD, post-traumatic stress disorder. Can you please give us an understanding of what it actually is and maybe in what circumstances it develops, how it develops for people, and why it can be so hard to treat?
Yeah, so many people experience traumatic events in their lifetime, or they witness a traumatic event in their lifetime. Some people experience through, the way they were brought up or where they were brought up, contexts in which they live, quite a lot of traumatic events, compounding traumatic events. So it's not the traumatic event itself that necessarily leads to post-traumatic stress disorder. And it's common too if people experience a traumatic event. So what I'm talking about there is things like, sexual assault or sexual abuse, violence, witnessing violence, sometimes like with domestic violence, but also things like stalking or prolonged bullying, sometimes things like, car accidents, near-death experiences, storms, that kind of thing. So it can be acts of nature, but more often kind of acts of other humans. And then there's things that kind of veterans experience in war situations or civilians experience in war situations. And it can also include things like, corporal punishment and, prolonged fearful situations, especially in childhood. So there's a huge range of things that might qualify. But it's really what happened in the experience. So how that was processed or not processed at the time. And there's a lot of things that go into how that happens, which we can talk about. And very importantly, what happens or what didn't happen just after the experience. So if people go through a really difficult situation, say there's a bushfire, they come close to death, then there's a lot of community support. There's the ability to express and to cry. There's a community situation where everybody's kind of pitching in and there's this kind of mutual understanding of what happened. A person like that is much less likely to get post-traumatic stress disorder. There's a way that the nervous system and the psychology of a person will kind of process that in a natural way. They'll have like maybe post-traumatic stress symptoms for a period of time, a couple of weeks or a couple of months, but that will naturally heal. So that's normally what happens. If a person is impacted in the moment in a way that feels completely overpowered, they can feel completely helpless, they dissociate or freeze, or just after they're not believed or they're shamed or ridiculed or isolated, there's a much bigger chance that the person would go on to develop post-traumatic stress disorder. So by that I mean some of the common experiences are re-experiencing. So that would be having intrusive thoughts or memories or dreams, having intrusive somatic or body-based or emotional kind of flashbacks. So hugely elevated heart rate, gastrointestinal problems, flare-ups in kind of fear or terror. People become very hypervigilant so that they're really worried about what's going to happen next. They might be very, very hypervigilant about people in their environment if they've been hurt by someone else. They might not be able to trust people in the same way, and that might really impact their ability to participate in life. People can go into like really big mood disturbances, so they can explode with anger, too much expression, or they can sort of really go into a numb out, too little expression, so they can't sort of engage with any joy with activities they used to find enjoyable. And also problems with concentration, problems with memory. So very debilitating problems where a person's constantly being activated and re-triggered. So their body is feeling and acting as if the trauma is still happening. And also these really impactful problems on mood, on perception, on belief systems about themselves and trust of others, and also all these cognitive issues and problems in that way too. And people who get stuck in post-traumatic stress disorder go on to have physical health problems as well. That level of cortisol and adrenaline constantly going through the body can really ravage a person's physical health. And obviously their relationships become affected, their ability to work. And so it has a huge impact on people's livelihoods, on their mental health, obviously, and their relationships. So it's a really difficult one for people to live with.
Because like you said, it has such a flow-on effect, even if people aren't experiencing the trauma in the present.
Yeah.
If you're having those intrusive thoughts or the flashbacks, or if your heart is racing or your stomach's clenching, it's like you're reliving it or you're still feeling it. And so that's affecting your experience, but not only the effects to the individual, but the effects on relationships or whether they're able to maintain a job.
Yeah.
That's really hard.
Yeah. Yeah. And it's scary to get stuck in because people feel like they're losing their mind and their belief systems get shifted. So they start to often take responsibility as if there's something that they did wrong. So there's a deep sense of shame. There might be a deep disbelief in the character of humans in general. So there's this deep distrust in others. There might be a complete hopelessness about the state of the world. And so it's the belief system shifts that become really difficult as well. So there's the nervous system stuff and there's the belief system stuff, and then there's the kind of the impact on their behaviours and functioning. So at every level, it's really impactful. Yeah.
Do you find in general people delay seeking treatment because they're confused about what's happening? Or
yeah, so a few things that get in the road there. One is that often people do carry a sense of guilt or shame, and which really sort of impacts their ability to want treatment or to seek it out. So that can happen. The other thing is that, the event's over and people after a big event are sometimes, people around them are very helpful and they'll help with food and the practical stuff and they'll help with kind of being emotional support. And then after a few weeks, people go back to their own lives and the person is kind of just, although they're surrounded by people, they might feel quite isolated. They might not feel like they can keep bringing it up. It's almost like it keeps reoccurring in them, but they don't want to keep talking about it constantly with everybody else. They know that that's not kind of helpful as well. So people can sort of go inwards and shut down and become very kind of ultra independent, but also stuck and desperate and hopeless and not show that to anybody. So they just grit their teeth and kind of get on with it. They'll drink more, they'll work more, they'll do all the coping strategies to try to do it and to try to get through. And it isn't until things get really desperate, a few months or a few years down the track that they'll seek help. And the other thing is people go to see a psychologist or someone else. And with PTSD, we do need specific treatments that really target how it's held in the nervous system and how it's held in the belief system. Just talk therapy alone doesn't help post-traumatic stress disorder. For some people with great internal resources and good support sessions, talk therapies can be quite good. That person can make sense of what's happened, they can get the support and validation, and that can trigger this natural healing process. That can work really well. But for many people who are stuck in PTSD, they need kind of much more than that.
were you saying before EMDR can be quite helpful at times? Could you maybe try and explain that?
Yeah, so EMDR is like one of those therapies that, it came out in the late 80s, so it's been around for a long period of time, but it's one of those therapies that we're utilizing a body-based method with a kind of cognitive and talk therapy method. So when it first came out, people were like a little bit suspicious of it because we weren't used to utilizing the nervous system. Yeah, people thought it's woo-woo. We thought all psychological problems are in the mind, even though we haven't defined what mind is yet in psychology. We don't know what we're talking about yet. It's interesting in another podcast.
Consciousness.
Yeah. So, but we also know now that all of these things exist in the body as well, especially PTSD. It's stuck in the nervous system. There's an incomplete trauma response process that hasn't finished in the nervous system. So a person got stuck in freeze mode at the time of, say, a car crash, and that freeze mode is still inside them. And in that frozenness in their nervous system, their re-experiencing keeps happening. It's as if there's a frozenness in time. So we actually need to unfrost that. And one of the ways we can do that in EMDR is that we find the target of what a person, where they got stuck, the images that come with that, the feeling in the body that came with that, the belief system that gets aligned with that. And we have them go through this kind of mindful process of having dual attention of the here and now in the therapy room of safety, but also of the moment. So it's almost like they're in the past and the present at the same time. They've got the support of the therapist there. And we use eye movements to move their eyes left and right, left and right, left and right, left and right as they're processing this. That works the working memory in a sense that, and also creates this kind of like a mild altered state of consciousness where a person is able to unfreeze what happened, to complete what happened, and to have a different perspective of, and then also a different belief system of what happened. So rather than some sense of like, I was responsible for that car accident, what is wrong with me? It's like, I survived and I made it. And so a perspective shift around what happened and how they relate to what happened and the story they tell themselves about what happened makes a big difference. And also you'll see people expressing the leftover kind of trauma content in their nervous system. So they'll shake, they'll cry, they'll emote, all this stuff that was frozen inside them will start to kind of come out, which is important as well. And so there's this kind of body process, nervous system process, and this psychological kind of rewiring or re-reckoning with the past.
It's more holistic in that you're addressing the nervous system and the psychological aspects together and the physical.
Yeah, and the two are interrelated.
Yeah.
So what we know is if there's a sensitized memory, so a memory that when you think about it creates a lot of disturbance and distress, if we can desensitize that image, we find that the belief system will start to shift. If we don't desensitize the image, the belief system stays rock solid. So I'm worthless or I'm unlovable. These belief systems, they can't shift unless we desensitize these frozen, deeply held, re-experienced images from the past, it's a fascinating part of like how humans are kind of built.
Yeah.
But we've kind of found that there's this kind of process that can help.
We've talked about some of the great treatments that are available and do work for some people, some of the time or a lot of the time with depression and PTSD. Acknowledging that sometimes people with those conditions are resistant to the current treatments that we have. So I first heard about psychedelic-assisted therapies a couple of years ago on the Tim Ferriss podcast. Are you familiar with him?
I am, yeah.
And he personally has invested financially, funded a lot of research into psychedelic. And he had some people on talking about how they were using particular substances in particular doses and combining it with psychotherapy and getting some great results for people with long-term depression or even PTSD. Until Ricky mentioned that you went to a conference, I think it was a few months ago in Colorado, and he said you were talking about psychedelic-assisted therapy there. I wasn't aware that we now have some trained therapists practicing this in Australia.
Yeah.
I wanted to have you on to talk about that because I want to give people hope that there are some new treatments coming for people. So if you could please explain a bit of the history about this psychedelics and the therapy and how it's being used in practice.
Yeah, it's interesting. This is still not widely known, and there's reasons for that. We're not allowed to advertise it and other reasons why people don't know about this. But yeah, in 2023, the Therapeutic Goods Administration, the TGA in Australia, made a decision after lots of advocacy from different organisations in Australia that we would be allowed to provide MDMA-assisted therapy for post-traumatic stress disorder and Psilocybin-assisted therapy for treatment-resistant depression. So in the clinical research around the world, they're two of the conditions and two of the treatments that have shown initial promise in the clinical trial outcomes. So Australian government's decided to start there with the idea potentially down the track that we will kind of open it up into other conditions and things like that. So yeah, what many people don't know is for the last couple of years, we've been treating people in Australia for that. And it's a work I've been doing for the last 18 months. So I can talk a little bit about what it looks like on the ground and how that's working and what we're seeing. Yeah, and this is they're new and emerging treatments, but just to give a bit of context, MDMA-assisted therapy, the clinical trials in that area, mostly in America, but also around the world, have been in play since the very early 2000s. So it's about 25 years of clinical trial experience and research outcomes there. And for psilocybin-assisted therapy, so psilocybin's kind of one of the active ingredients in magic mushrooms. People have been using that from the late 50s through the 60s and the early 70s. There was a lot of research in that area. So there was up to 40,000 research participants, across that area. And then that research got shut down in the early 70s by the American government for different political reasons. And so all of that research was kind of put on hold.
Right.
And it wasn't until the late 90s and the early 2000s where people started to kind of get the licenses to kind of research this again. So it's kind of new and emerging in a way, but it's kind of actually not so new and emerging in a larger context.
Got a solid basis of research behind it and practice.
Yeah, and also, psilocybin mushrooms have been used by different indigenous cultures for hundreds and maybe thousands of years. There's different kind of archaeological evidence for the use in different parts of the world. So this is not a new thing in, human culture. The MDMA-assisted therapy was used a lot for couples therapy in the 70s and the early 80s. Wasn't made illegal until about 85 in America. So there was a period of time there where it was being used by therapists for those indications. And then that therapy had to go underground, at that stage after it was made illegal in 85. And so it's only been again since, the early 2000s that's been come out in more research. So just a bit of the history, I guess. So we're not doing things that are totally experimental. We're kind of riding on the back of lots of clinical trial work at the moment.
Before we get into what it looks like in practice, in what you've been practicing for the last 18 months, we do have listeners all around the world. We were talking before, like say for America, for example, is this widely available and legal everywhere in the US or only in particular states at the moment?
No, Australia's the world leader. So we're the only country in the world that can offer MDMA-assisted therapy in a clinical context. In Switzerland, actually, they've got a special access scheme where they can apply to do that on a case-by-case basis. And so they do a little bit of that, but they're fairly kind of quiet about it and small scale. In America, it's not legal at all. And their equivalent of the TGA, that they call the Food and Drug Administration, the FDA, has rejected the application to bring that into legal treatment thus far. They're asking for another clinical trial, perhaps. Right. So they're in the late stages of seeing if they can make it an approved treatment. So it might be a few more years away in America. With using mushrooms or psilocybin, there are a few states in America that have legalized that for use in registered clinics. So Oregon is a state that's done that. Colorado's a state that's done that. And in some other states, they've decriminalized the recreational use, but there is no nationwide treatment for any of these substances. And in fact, under federal law in America, these substances are still illegal. The state laws are different. And so they've got a funny system in America where sometimes the state laws are different than the federal laws, and they can kind of create a situation where they can provide a treatment that's not actually legal federally. So it's all a little bit of a mess in America at the moment. So they're still working it out.
They've got people advocating.
Yeah,
I'm hearing.
Lots of people advocating in different states for different treatment programs within their state legislature, and they're all looking at it in a slightly different way. So for Oregon and Colorado, for instance, people can access those treatment centers, but in Oregon, as an example, it's not people who have chronic mental health conditions. It's people who might need help with a life transition or, mild depression or prolonged grief or some other challenge. Whereas in Australia, we're really targeting people with severe and persistent mental health conditions. So treatment-resistant depression or PTSD that's been around for, quite a while for someone, and they've tried lots of different things before. So the people we're seeing have quite a complex or enduring mental health condition, and they've often tried many, many things over many years. So by the time they get to us, they feel like they've exhausted different treatments.
Yeah.
And we're seeing a lot of what they call comorbidities. So it's not just PTSD. There might be anorexia that comes with that, or there might be depression and OCD, or so people are coming with not just one kind of mental health condition. It's often a mixture.
If you could talk us through, what does this therapy look like? Like, it's in conjunction with traditional psychotherapy, is it? So what does that look like? But how does using these compounds in the therapeutic doses, how does it work? Obviously, the results are quite promising. And what kind of results are you seeing?
Yeah, the important thing to say, and we have a hard time having this stick with people, which is it's psychedelic-assisted therapy. Now, what we're doing is we're combining psychotherapy with a particular compound that has certain properties, and I'll talk about the difference in the properties, that can create a non-ordinary state of experience that can allow us to work with a person in a way that we couldn't do in a regular therapy setting with ordinary state consciousness. So we're shifting someone's state of consciousness so that we can make therapy more powerful. So the drug itself is not what we're kind of really focused on. People get fascinated about the drugs and, what do they do in the brain? How are they doing this? We're actually just opening up windows in the brain so we can be better at the therapy. So many people who, maybe have experience trying recreational MDMA, those people would know that just having MDMA alone doesn't really do much for their mental health. In fact, they might struggle a few days after and stuff if they're combining it with, dancing all night and drinking too much as well. And again, having a mushroom experience might be interesting or kind of like beneficial in some ways, but it doesn't automatically help with depression. So it's the therapy component. So what we're doing in the treatment is these are long therapeutic programs, so they're like 4 months. We have 3 preparation sessions where we orientate a person to, what they're going to be expecting, what it is they want, what their goals are, what their intentions are for the therapy, helping them with certain skills and resources. So when they're in the sessions, which are generally pretty difficult, they've got something they can use as kind of tools, and getting to know them and they're getting to know us and building that trust together. On the dosing days, these are all days and all day sessions. We give a person the psychedelic in the morning, whether it's MDMA or psilocybin. And then we have this kind of elongated therapy session. So for MDMA, a person's coming in to work on their post-traumatic stress disorder and what's showing up in context of their life. The MDMA gives them certain qualities that they don't have in everyday consciousness, more self-love, more self-compassion generally, a little bit more energy, a sort of a reduction in fear so they can go towards memories or experiences that they couldn't do in normal consciousness. And this ability to sort of really take perspective, to be able to see what's happening now, but also to zoom right out and see both the past and the present and the future a little bit more clearly. That allows people to engage in the difficult trauma therapy with these kind of resources on board. And there's 2 therapists. So we've got 2 therapists in the room, each with different kind of temperament and skill set and relationship to the person. And so a person will go between doing internal work with a prescribed playlist, so people have headphones on. They're going in with a certain set of skills and resources which we've helped them with, and they're working on their own inner psyche, their nervous system, their memories, their history. Mm-hmm. And then they'll pop out every now and again and engage with the therapist and do a piece of therapy working on that. Yeah. Then they'll go back in again. And so there's quite a natural process of kind of in and out as they do that work. And the qualities of MDMA are really ideal to help a person go through that process. Then the next day we meet for an integration session. So we're trying to make sense of, map out what happened, but also start to embed what happened into their everyday life. MDMA opens this kind of a critical window for a couple of weeks after where people can make changes and work in their life and their belief systems and their habits and patterns in a way that they can't normally. So it gives us this kind of window of opportunity. And we have 3 integration sessions after a dosing day. And then we go again, so second dosing day, then 3 integration sessions, and then third dosing day, 3 integration sessions. So we got lots of integration sessions, 3 dosing days, and about 4 months or 5 months to work together.
And it builds on each other, each session.
You said something about compounding before, which is in therapy, which is really the key here. We're compounding these insight, this self-perspective, this self-compassion, and also the nervous system stuff I talked about in the EMDR as well. So psilocybin's different, where that's mostly, not always, but mostly a more internal experience. And that connects people to often larger feelings of connectedness to loved ones, to self, to nature, to the cosmos, to universe, to big things, to spiritual things sometimes. Can give people an expanded perspective on their life. Can take people back into memories and experiences and have them kind of re-experience that, but in a kind of a new way. And can allow them to have these kind of imaginal or symbolic or deeply meaningful experiences that can give them just a whole new perspective on their life or their challenges as well. And so there's a little bit of talk therapy component there, but mostly it's kind of people going through an inner process of that. So they look very different sometimes.
I think the critical point is that re-experiencing or reprocessing particular events or memories, because people get so stuck and so rigid in our beliefs and our mindset. So, and as you said, sometimes just in normal therapy sessions, there might be just something missing to allow someone to really open up and access that. So if there is a way with this where there's a more openness to experience, and to be able to move past that stuckness, that's wonderful.
Yeah, well, people come with all their habits, their protectors, their coping skills, their lenses, their everything.
Armour.
Their armour, right? And the armour's there for a reason.
Yeah.
So they come into the therapy room in a normal therapy session, and you're kind of working with their armour as much as you're trying to work with kind of healing some pain or to see different perspectives. But lots of armour work, whereas these substances can really change a person's ability to relax the armour and to get into some of the stuff that's around underneath all of that.
Yeah.
So that's where they can be really helpful.
And so what kind of results, I know it depends on the different person, but in general, what kind of results and how long lasting are you seeing the results? What can people expect?
Yeah, this is the long lasting thing is where I'm really interested in. It's a great question. We don't have good information yet. So just for the MDMA-assisted therapy for PTSD, so the main results come out of clinical trials run by MAPS in America and the Multidisciplinary Association for Psychedelic Studies. So they've done a bunch of phase 2 and phase 3 clinical trials. In their results, about 2/3 of people are coming out as kind of not meeting the qualification for PTSD anymore. So what we would see is PTSD-free symptomatically. A further third are having some benefit, but still, meeting the criteria for PTSD. There's still about a non-response rate of about 10 to 20%. So there's still people that aren't getting benefit for different reasons. What we're seeing is something akin to that, but what we're doing, the work we're doing is seeing people in a real context. So it's not just people who are chosen for a clinical trial. So in clinical trials, a lot of people are rejected because of exclusion criteria, whereas in our clinical practice, we're including people because people need that help. So we're seeing people with lots of comorbidities, lots of life stage dysregulation, lots of bits and pieces that, regular people have. Life is messy, so we're getting all of that coming in, which is the work that we want to do and what we're welcoming. Yeah. And so it's a bit trickier for us and what we're looking at. Yeah. So, but we're seeing, again, about 2/3 of people that are getting some good benefits and a further third that maybe the treatment was not as effective as they'd hoped, or maybe the treatment opened a little bit of a door and they need to persist with therapy for another couple of years to kind of work on that door that was opened. And so because there's a bunch of people that have come through the program, a year and a half ago, we're just going through this review process where one of the people, because we're collecting data as well, it's a phase 4 trial, he's calling through and checking how people are going, and he's reporting back on, where people are at. And so we're hearing these beautiful stories of, just heard one the other day where a person that I was working on with a co-therapist of mine, she's taking up yoga, she's doing singing classes, she's feeling free, doesn't have the symptoms of PTSD like she did before. And so this is a year on. And just after the therapy, she was doing better, but she was still very much in it. She had a great therapist that continued the treatment. So what we're finding is that 6 months to a year of prolonged therapy after the treatment really makes a difference.
Yeah, keep working on any residuals and integrating.
So for me, the take-home message I want to pass across to people is that this is not a magic bullet therapy. For people who are worried well, or people who are just, they've got one big issue but the other parts of their life are okay, sometimes it is that magic bullet. But for people with chronic, enduring mental health, issues, this opens a window to a much bigger opportunity, but also it can be destabilizing, it can be dysregulating, it can be really tough. And there's a lot of work to do after the therapy to really put things in place. Yeah. But what we're finding in MDMA-assisted therapy, in our treatment program and also in the MAPS trials, is that people are generally getting better after the year out. So because the PTSD is relaxed or sort of rescinded a little bit, people are able to start making some changes and they're slowly getting better. The psilocybin-assisted therapy is a little bit more, we don't have as much good clinical trial data. There's no phase 3 trials that have been published yet. There's only phase 2 trials, which are much smaller, so that what we can say is not as comprehensive. Many people are relapsing after 6 to 12 months. We're not sure why that's happening or who's relapsing and who's not. We don't have that level of kind of long-term data yet. Again, in our clinical trial program, we're finding a mixture of people that are getting this beautiful kind of opening and opportunity and relief to then, go on and kind of engage in life in a different way. And we're getting some people who are getting these windows of opening and then going back into depression again. We're not sure with the psilocybin-assisted program what the long-term results are, whether certain people might need like a yearly kind of treatment to hold the results. Yeah. We don't know that yet. And the kinds of people that respond and the kinds of people that don't, the kinds of people that respond have a long-term treatment outcome, and the kinds of people that don't, we're sort of still needing to find that kind of information out. But for people who have been stuck in depression for, 10 years, to have 6 to 12 months of openness is a big deal.
It's life-changing.
It's life-changing, and it does give them the opportunity to try to make some key changes that can maybe, embed something different.
Influence going forward.
Yeah. So
if people in Australia are interested, what would be the first step if they think, that sounds like me, that might be something I'd like to go try? How do they qualify, I guess? How do they find out more about it? But also need to point out some people would be contraindicated and not suitable for this kind of therapy.
Yep.
So if you could cover that, but also let us know how people might get in touch.
Yeah, the inclusion criteria, the exclusion criteria, and for some people the contraindication is really important. So just on accessibility, I'll say, one of the things that is really difficult is that these are expensive treatments because there's so much therapy, there's a lot of work that goes into it, there's the medicines, the rooms and everything like that. So, a 3-dose, 12-session, 4 to 5 month treatment period, we're talking about somewhere between $25,000 and $35,000. So for most people, that is just inaccessible.
Out of reach,
yeah. So at the moment, the Department of Veterans Affairs has just signed off on facilitating a pathway for veterans for that.
Great.
There's a lot of paperwork and it's difficult to get into, but you can do it. And they're seeing this as an emerging treatment that they're interested in. So they've got a lot of as a government department would, they're very conservative about it, but they've opened the pathway. So that's just happened.
That's great.
There are some insurers, work cover and stuff insurers that are kind of open to this kind of thing because they're seeing that, hey, if this can make the difference, then it's actually going to be a money saver.
It's going to be economical. And the government, I hope, is paying attention. Other departments as well.
Yeah, we're hoping Medicare will be able to provide rebates. So we're working on that. So the funding situation is kind of happening in the background.
Yeah.
And as we get more results, as we show that it's safe, as we show that for a bunch of people this can be life-changing, and as we start to get a bit more nuanced on who it works for and who it doesn't, then the insurers and the government departments are starting to come on board. Yeah. But in the short term, the cost is very high. Mm-hmm. So that's one thing. As far as exclusion criteria, these substances aren't good for anybody with a history or a direct family history of psychosis or bipolar 1 disorder. If people have, heart issues, cardiovascular issues, they're generally ruled out. People who are, pregnant, obviously, there are some, exclusion criteria around other specific kind of kidney and liver issues and stuff like that. So, what we do in the lead up is get a GP to sign off on some things, and the assessing psychiatrist will look at some of those exclusion criteria as well, just to make sure that a person is not going to be, harmed by the process.
Yeah.
The TGA rules, we can't actually advertise, so you can't kind of Google who does this.
Okay.
The best thing to do is to talk to your health practitioner, whoever that is. If you're not already getting, support from a psychiatrist or psychologist, you likely won't be eligible anyway.
Okay.
So these are for people who are getting current treatment and the treatment's not helping them or sort of exhausted its kind of benefits. The health practitioners will generally have colleagues that, know about this, and they'll be able to contact and put you in touch with people. We can talk to other health colleagues about what we can advertise to other health colleagues, let them know, but we're not allowed to advertise to the general public. It's not straightforward, unfortunately.
No, but I appreciate your honesty. I appreciate the detail, and just to share awareness that these therapies do exist and they are going to benefit some people who haven't found benefit in traditional treatment. I think that's hopeful. That's great.
Yeah, one of the things that's happening, because people feel hopeful about it, but they can't afford or can't access these treatments legally, many people are going to underground therapists. So that's just happening around the world at the moment, especially in America and Australia and other countries. So just to kind of like just want to give like a public service announcement, I guess, for that. Just to know that there are adverse experiences people can have, that there's prolonged, challenging experiences that people can have if they have a bad experience. And it's not necessarily the substance itself. You know, if the substance is a good quality and pure and things like that, they're generally safe if you don't have physical or psychological contraindications. But the context in which you do it and the support in which you get and the professionalism in which that's delivered makes a big difference about how you'll go. So just say to anyone out there looking to engage in any underground experiences, really do your research, get feedback from other people who have been to that facilitator or to that group, talk to the facilitator or group. If the facilitator is not, finding out about your health history, if they're not asking about your psychological history, then that's a red flag. If they can't answer, reasonable questions about their, what's their emergency protocol if something goes wrong, for instance, or if you're struggling after the ceremony, you need support, what's their role in that? You want to know all those things. And so just do your homework and just make sure that you know the person well. They offer you preparation sessions and you feel quite comfortable in their space as well. So yeah, one of the other aspects of the work I do is helping people navigate adverse, prolonged experiences from bad trips. So it does happen and people can get much worse actually. And so, these are substances and experiences that have a lot of power and therefore that they also have a lot of risk. And I would just say just be diligent on your own behalf and
not advocate for untrained, unlicensed people.
Yeah, I mean, and I understand that people want to do that, and I'm not sort of, advising against it. It's just that it's hard because a person who's looking for a treatment like that, how do they tell if someone's like a good practitioner who's trained well, who knows what they're doing? It's very difficult for a regular person to know that information. So
for sure. Yeah. Thank you.
But I would say, if you want to engage in that, engage with a psychologist or a therapist first, get that support. And then if you want to sort of do some underground work, then you've got actually support already set up in place in case if they go well, great, you can build on that. And if they don't go so well, you've got that support as well. Definitely. So just a bit of a harm minimization message, I guess.
Thank you. It's important. Is there anything else you wanted to let us know about the therapy?
There's a range of different, if anyone who's interested, we're working at the moment with MDMA and we're working with psilocybin, but there's a whole range of other clinical trial stuff happening, 5-MeO-DMT, ibogaine, with LSD, ketamine. There's lots of psychedelics that are being investigated with therapy to match certain, challenges that people are having mental health-wise. So
they're doing clinical trials,
Yeah, lots of stuff like that. So
that's good to hear.
So lots of stuff happening, and not just in the realm of mental health, but looking at, dementia and Alzheimer's, looking at head injuries, looking at, other areas that, chronic pain, headaches, lots of bits and pieces, yeah. So this is an emerging treatment that's going to kind of change the landscape of, health treatment over the next 10 years. It's pretty exciting, but we don't know yet exactly who it helps and who it doesn't. This is what we're still finding out. Yeah.
To do the research and the trials, but then to put it in practice and then gain the data from putting it into practice.
Yeah.
But it's happening, it's starting. Yeah, that's exciting.
And Australia's kind of leading the way in some sense, so that's pretty exciting for us to be able to contribute into that.
That came to be just the government was open to it, or good advocacy from?
Yeah, there's a few organisations in Australia that are very strong advocacy-wise, and they fought pretty hard to get to the right people to make those decisions. So I think all of the decisions in government, decisions in these kind of health decisions, and with Medicare and DVA and things like that, if you can get to the right people with the right message and the right information, you can make changes. There's some people like me focusing on the kind of the therapeutic work, and there's other people focusing on policy and advocacy. So
all needs to happen, doesn't it?
Yeah. So we're trying to tread carefully, but also tread bravely as well at the same time. And it's like trying to get that mix right.
Yeah. Very exciting. There are so many things we could talk about. Like I could pick your brains about. We're limited for time today, but is there anything else that you'd like to share with our audience or let people know about that's important to you for people to know?
Wow, that's a big question.
I know.
We talk a lot about change, but just as important, and the other side of the coin, is acceptance. And so I just want to keep reminding us all that self-acceptance, self-respect, self-love, these are beautiful therapeutic qualities and actually maybe what we're really aiming for anyway. And so I just think we get caught up in what do we need to do, change, develop and grow, and that can all be pretty cool, but yeah, it's that other aspect too, which I think we really need to, acknowledge and not forget.
I think, yeah, that's beautiful. It is very hard. But as you said, it's a worthwhile endeavour to keep trying to move forward with acceptance.
Yeah.
And it can come to different degrees. Like I'm sitting here today, I wouldn't say I have full acceptance of myself, but even just recently opening up about having OCD, which I'd only mentioned to a handful of people, I said to one of my good friends the other day, I feel a little bit more self-acceptance in having done that. And I think ultimately your own acceptance is what matters, and it gives you a bit more confidence, I guess, not to worry so much what other people think. So yeah, I think with each experience or phase of life, you might get a little bit more acceptance, hopefully, and keep moving towards that direction. So yeah, thank you for highlighting that.
Yeah, and I really admire your sort of bravery and speaking up about that, because it inspires so many people and it really helps with that acceptance piece. And to start to see these qualities in us, just over time when we start to get a relationship to our quirks and our hang-ups and our bits and bobs, it's okay.
It is okay. I mean, everyone's so different and it's often hardest to embrace yourself, I think.
Yeah.
Which is interesting, isn't it?
Yeah, and part of the therapeutic journey, it's yes, people do need help to take out the distress and the severity of some of these, what we might call symptoms or, disorders or whatever. But, after we do this, it's coming to terms with just, that's part of our psyche. And so, yeah, I really encourage people to take an approach to this in their own sort of journey of not trying to get rid of these parts of ourselves or these aspects of ourselves, but just develop a relationship with them, and that is more about kind of internal respect and internal understanding and those sorts of qualities.
Self-compassion.
So, yeah, and it softens so much internally when we can take that kind of quality.
A question I ask everyone on the podcast, how do you personally mind your being? Do you have some particular practices or rituals that you could share with us?
Yeah, I shared before about intense exercise. So that's really important for me. If I don't get that, I don't do so good. So I gotta get that. Yeah. I said at the moment it's Brazilian Jiu-Jitsu, but it could be anything. I've done other things, CrossFit and kickboxing and stuff in the past, and even soccer and stuff like that. As long as it's physical,
it's intense,
it's really important. And as you get older, that's challenging.
Yep.
Injury. I'm injured now. I've got a knee thing, and I've got some other stuff. So that's an interesting journey.
It's hard to balance. But
it is, yeah. I'm a loner by nature, and I spend a lot of time introspectively, and I'm an introvert and stuff. But if I don't get a good dose of people, I suffer. So friends are really important, family, colleagues, all that kind of stuff. Sometimes I've got to dose up on those medicines. I need to make an effort to do that. I can get sort of very in my own world.
It might not happen naturally, so sometimes make an effort.
Yeah, I've got to really keep making an effort there, which I'm pretty good at, but I have to work at that.
Okay.
And you mentioned sort of mindfulness and meditation to me before, and I spent a lot of years meditating and things formally, the sitting meditation, but I do less of that now, and I'm more kind of meditate as I'm just in the world. I kind of really bring that meditative practice and experience just more and more to my day-to-day, moment-to-moment experience. So I find that when I do that, I'm able just to relax the tension in my body, my breath, my nervous system, my thinking. The more I can remember to come into like the moment now and release some of this tension, it's so important. I'm very orientated to moving forward. I'm always like looking for a project and doing things. I can get very obsessed about stuff.
Sounds familiar.
Which is great, but there's a lot of tension involved in that, you know, in this kind of chasing, pursuing stuff. And so for me to remember to do that's super important. Yeah.
It's good that you're aware of that though. And I found the same thing with meditation. I mean, unless you're a monk practicing 24 hours, we're not always going to be mindful. We're doing a lot of the time. But what it teaches you is that awareness, and that at any point in time, you can come back to yourself, your breath, mindful moments. And as you said, you can come into the being instead of the doing or pursuing.
Yeah.
So it's something that's always available, and I found it really helpful. I initially came to it for stress reduction, stress technique. I think a lot of people in the Western world anyway.
Yeah.
But what it does, and like I've said before on here, it is probably, apart from having therapy at different points in time, it is a thing that I think has helped me get most unstuck, because I have had, or still do at times, that inflexible psychological thinking. And meditation, mindfulness, or listening to people talk about consciousness and different things, I think it changes your perspective. Have you found that? Like like a more empathy, more openness. Have you found any of that?
With the practice of mindfulness and
and meditation, like a perspective shift, which carries with you. You think differently in a way, but I'm not sure how to articulate it. I just encourage people.
Yeah, I mean, I'm highly neurotic as a person, so.
Sounds familiar again.
like if I don't release from my body and relax my mind and settle my thoughts and do all that, I can get into a bad situation pretty quickly. You know, I've learned that over many, many years. This mindfulness meditation skill set allows me to not just relax my nervous system, but allow the neurotic kind of entanglement to sort of like soften a little bit. And behind that and around and within that is like a lot of peace and openness.
Yeah.
And that's nice to remember that that's there. And it's there now and forever all the time. It's just a matter of recognizing it.
Yes,
so,
in an instant.
So it's beautiful to just be able to access that whenever you need to. And you know, for listeners who are like, that's impossible, one is it just takes ages to kind of, it's like any skill. But two,
you have to practice.
You got to practice, lots.
Yeah.
And you don't have to be good at it. You just got to keep doing it. But also, if I'm totally overwhelmed or activated or triggered or burnt out or whatever, you know, I can't get there either. So it's like, you know, this is not a magic thing that cuts through everything. Sometimes I need, you know, therapy, or sometimes I need
in nature.
Walk, or a good hug, or you know, heavy metal music is another way for me to sort of.
I heard you say that. Yeah.
So, like, sometimes I need intensity, right, and sometimes I need like kind of like letting go. So. Yeah, everyone finds their own way.
Yeah, music is intensely therapeutic, depending whatever genre you're in. I'm curious, how did you, or when did you become aware that like intensity is the opposite to meditation kind of thing? So how did you become aware for you that intensity of exercise or, you know, heavy metal music is what can help you unwind?
Yeah, I mean, it's a slow and confusing and elongated process of self-discovery over the last like 48 years, I guess. It's hard to know when it all started to sort of, but I guess over time, as a start to kind of like experiment and notice and try different things and become more self-aware, just get to know yourself a little bit more. And the thing about self-acceptance we're talking about, not fight against stuff. Like, just know, like, if that's what I need, if I can sense it, like, go with that rather than think I should do something else.
Or someone else wouldn't do that. Like, for me, I do like to exercise, and sometimes with intensity. So for me, it's not always about intensity. It might be the calming or the breathing techniques or whatever, but it's what works for you.
Yeah.
And so it's taking the time to reflect, I guess, and try different things.
Yeah.
And it doesn't matter what it looks like to someone else.
Exactly.
If it works for you.
Exactly. Try, experiment, sense into things, and don't follow any kind of rule set.
Yeah.
You know, don't worry about a pathway. Just do whatever feels like intuitively right for you.
Yeah.
And that changes. Like as I change over time, what I need changes over time as well. Yeah, I mean, I don't have it all together as well. I'm still finding things out, and I still fuck up all the time, and I still forget everything and
That's
feel
being
confused.
human, though. No one has it all together all the time with every situation.
Yeah. And I forget everything I've ever learned, and I get into this stage of confusion and chaos, and then I realize.
Do you berate yourself and go, well, I'm a psychologist, I should know this?
I don't. The self-acceptance is the one thing that's actually perseveres.
Awesome.
Which is, everything else kind of falls over and stumbles, but actually that is one thing that kind of sticks now. Yeah.
That's great.
Yeah.
That's a great foundation.
Yeah.
I wish that for everyone.
So do I, yeah.
I think a final point I wanted to touch on was we talked about earlier in the episode how adverse childhood experiences can shape the beliefs we have, and we develop coping mechanisms to deal with things. But just to give hope to people that either through their own reflection and experience or through engaging in therapy with professionals, that we can update our beliefs.
Yeah.
We can develop new coping mechanisms. What are your thoughts on that?
I absolutely agree. Yeah. Every pattern can be worked with. And again, we've got this mixture of kind of like changing, but also accepting. So we're playing around with that. But yeah, I mean, as it starts to sort of mature a bit, and I think people are maturing at a much younger rate. So we're getting a lot of 20-year-olds that come into our practice now with a lot of like nuance and knowledge and have looked at their attachment styles and stuff. You know, people are coming pretty informed. But there's so many ways to start to examine, soften, and maybe gently start to transform how you relate to self and how you relate to others. One thing I encourage people to do sometimes is just the attachment quiz. So there's a couple of great things online. You can just do an attachment quiz, and it shows you how you know, the patterns in which you relate to people you love and friends and things like that.
Yeah.
You know, that can give you some information.
Yeah.
And then they send you a PDF of different things you can start to do around that. So, you know, there's a start, right?
Yeah.
Some things, mindfulness meditation, people start as a stress reduction tool, but it becomes, over the years, it becomes a self-insight tool and a self-diagnosis tool. You can go, oh, I'm noticing that this is what's happening for me.
Coming up, yeah.
So there's that sort of technology. And then for some things, you can't do that with one mind. Some things you need another nervous system and another mind so that you can kind of make sense. It's too confusing or too emotional to do it by yourself. And that's where therapy can kind of be important. But yeah, like the last one I would say, the melting pot of all of this work is the intimate relationship. So your partner, unfortunately, is your best therapist and your worst enemy. And so,
tricky dynamic at times.
Exactly. So they're working their stuff out on you unconsciously, and you're working your stuff out on them unconsciously. And maybe together you can start to do that more consciously.
Yeah.
And that's a beautiful thing, and requires a lot of generosity, a lot of grace, a lot of owning up, cleaning up your side of the street, relaxing blame. Yeah. So there's a big journey there. So treat your partner exquisitely, because they're the ones that's going to reflect back and be that sort of crucible for your own work as well.
Yeah.
Yeah. And you're probably half wrong, so take that as a starting point. Yeah.
Yeah. You're right. It is it's an important, such an important, the most important relationship for your dynamics and your psyche, I guess.
Yeah. And just on that, because I'm always, have my mental health hat on too, there's some relationships that are characterised by coercion and violence and other things. And so, for some people, that's not the crucible to be working out your stuff in. For some people, boundaries and big decisions is what's needed, and support is what's needed. So again, just kind of a minimization message, I guess.
Thank you.
Yeah.
Like we said at the start, I wish the attachment stuff, I wish we learnt that earlier. Mm-hmm. Some of that was taught to us as well, because the fact that your attachment style can influence the way you relate to someone, especially in a romantic relationship. Yep. And I posted something the other week about that Harvard adult development study, and one of the most important findings and significant predictors of whether you live a fulfilled or maybe not fulfilled, it was a good life, happy life, is the quality of your relationships. And
Yeah.
I mean, obviously your romantic partner is the person you would spend the most amount of time with over your life. So it's so important.
Yeah.
But you don't sort of learn this stuff.
No, you got to work it out as you go.
Yeah. Oh, Mark, thank you so much.
Yeah,
this has been a great conversation.
Yeah, it's been wonderful. And like your podcasts like this do help people work it out and help people remember the stuff that they're, working on, and also gives people hope that there's other options and other treatments and that as well. So
thank you.
Yeah.
I really hope that it does give people hope. I hope it raises awareness on things maybe people weren't aware of, or it reinforces something they did know.
Yeah.
But I'm grateful to people like you who agree to give up your own time, and you want to help people as well.
Yeah.
So, yeah, thank you. It's been wonderful.
Okay, I'll see you next time for our internal family systems therapy.
Yes, please, and attachment theory. Thank you so much, Mark.
Okay, thanks.
Cheers. Thanks so much for listening to this episode of the Mind Your Being podcast. If you enjoyed it or found it helpful, please follow the show wherever you get your podcasts and share it with a friend who might enjoy it too. If you have a moment, please leave a quick review. It really helps others discover the podcast. Thanks again for being here. Take care, and until next time, mind your being.